Right now, it's amazing the number of Australians who live their daily lives in very uncomfortable situations, quite a good deal of pain. Did you know that 7 million Australians suffer from some form of musculoskeletal condition? And there was a survey done by an organisation called Musculoskeletal Australia recently to gauge the extent of this chronic pain problem and the impact of these conditions on these Australians with a view to getting a greater degree of help from the government. And the statistics are pretty sobering. 49% of the people surveyed said that they were affected by musculoskeletal pain every day of the week, 7 days a week. Over half of those surveyed said that that condition affects their ability to enjoy life in general. 76% of participants reported that their condition affects their ability to be physically active. 30% found that carrying out personal care, such as showering or getting dressed, is adversely affected by their condition. 45% of those surveyed feel that because of their condition, they're not able to make firm social commitments. Not able to lead as active a social life as they would like. 63% said that they needed to monitor the amount of social activity they undertook so that it didn't exacerbate their condition. These are alarming statistics, and what makes it worse is that generally, if you suffer from some sort of musculoskeletal condition, even though the impact on your life and your overall well-being and your pain situation is extreme, it's not obvious to other people. So it's very much a silent condition. You're forced to suffer in silence. I want to explore this a little bit further. Kevin James is 56 years old. He's lived with degenerative lumbar osteoarthritis since May 2009. And when he collapsed at home. But he wasn't actually correctly diagnosed until some time later. Kevin also lives his life with constant nerve pain, which has had an enormous impact on his quality of life. I caught up with Kevin to talk about his situation yesterday, and we started off by talking about how his diagnosis or how his situation first came about.
Well, it's not an easy question to answer, but to put it in a quick response, my doctor said it's age-related, but I have a feeling it's got a fair bit to do with the career and the fact that I was a registered nurse for many years. I also did a lot of driving, and I'm a very tall man, so a lot of people do have problems with their lower back, and I've had this condition since 2009, but it wasn't actually diagnosed correctly until 2012. So there are some issues there with getting a proper diagnosis. It's something that probably a lot of people would face with osteoarthritis or degenerative disc disease, which is another name for what I have. It's a gradual sort of realization that things are not as they should be, and then you go through the medical merry-go-round. You see a GP, you get an X-ray, you get more diagnostic information, more symptoms may appear, and eventually you might get a diagnosis. The unfortunate part is many people with lower back pain or perhaps osteoarthritis, they don't get a correct diagnosis for a couple of years. So there's this transient time where you're wondering what's going on, but it's a degenerative condition, yes.
Do you feel that sort of sets you back in terms of you could have been working on a solution or could have been dealing with the problem a lot quicker had the medical fraternity got it right?
Yes, it's actually an interesting question, and I believe that it probably affects hundreds of thousands of people, not just with musculoskeletal conditions, but early diagnosis is so important, and it's been a long journey for me. However, all I can say about that is you need to self-advocate for yourself. Knowledge is power, as the old saying goes, and unfortunately a lot of us suffering from chronic pain or osteoarthritis don't have that knowledge initially, and we've got to actually really teach ourselves and educate our doctors along the way. Some people get a diagnosis early, but many do not. So it's a very difficult time when you don't exactly know what the treatment is, and many lost opportunities, yes.
How would you sum up, though, the impact of the condition as it is now on your life? Because that impact has been quite profound, hasn't it?
Yes, I guess I'm just reflecting what many Australians have. 7 million Australians live with a musculoskeletal condition. Mine's a lower back condition, and it's an invisible condition. Musculoskeletal Australia have a saying at the moment, which is making the invisible visible. And there are many conditions, including mine. When you look at a person, you can't see it. You can't see that injury. I'm not missing a leg or a limb. And there is a stigma because of lack of understanding. And a lot of people develop social isolation and inability to attend events. They're unreliable. And there's a huge financial strain. And along with the whole range of emotions comes anxiety, depression, and the usual sorts of grief stages we talk about, which are denial, anger, bargaining, depression, acceptance. And some people never get to that acceptance stage. It's an up and down sort of phase you go through. You move forward, you move back. So it's a long way to the end of the tunnel, shall we say.
I guess the two major things, if I'm right, that have come out of it is that you had to give up work, and it was clearly the work that you loved, and also you are in fairly constant pain.
Yes, it's a difficult adjustment, and as well as dealing with an injury or illness that may well and has become chronic, there's also a lot of adjustment that people have to get used to when they lose a job. And to explain my circumstance, I reduced my hours. So I knew there was something wrong. I went to part-time work, but eventually I just went to work one day and said, I can't do this anymore because the pain is constant and I no longer am allowed to drive because of that reason, and the sciatica and the nerve pain that's associated with certain back conditions. Many people have to give up walking, driving, hobbies, social events. All activities of living, shall I say, are affected by this, and it does take a lot of adjustment and personal work on yourself to be positive to get over all these things. And that doesn't happen overnight.
And it's interesting too, because even if you tell people, I would imagine, to go back to that stigma thing, even if you tell people, look, I have this condition, I'm in constant pain, we're in a society now where we seem to be able to deal with pain so easily. You have a headache, you take an aspirin. If you have a backache, you rub this ointment on and it does the trick. Or sometimes there's even stronger painkillers, but we seem to have a painkiller for virtually every type of pain. Do you get that from people, that surely there's a medication that you can take that will take it away?
Well, yes, a lot of people, well-meaning people and friends, relatives and all walks of life, they want you to be well. They want to help you, and they believe that the medical system has something out there. But unfortunately, it's not quite so black and white, because a chronic pain condition is quite different to an acute situation. And many people, generalising here, who've had a stubbed toe or a broken bone or an operation in hospital, they have some hope at the end of the day because they know that their recovery period's going to be 3 days, 3 weeks, 3 months, whatever the doctor has said. But because of the nature of chronic pain, it's just a relentless sort of journey, and you have to constantly work at your positivity every day. And you do need, in some cases, to take very strong pain medication, but even that does not work, because the goal of pain management is to reduce pain. And I believe calling something a painkiller is actually a bit of a misnomer, because it never does actually kill the pain. I'm all for changing the wording to pain relievers, because for us chronic pain people, we just hope that the pain is relieved in some small way for most of the day. That's all we ask for.
And how do you do that? I mean, short of medication, which, as you've just described, doesn't necessarily work, or it might only relieve it, but it certainly doesn't take it away. How do you overcome that pain? How do you do that with your mind and with your habits, and I guess mainly with your mind? How do you do that?
Well, it's, again, a step-by-step journey, and not something a person who's just entering this phase of chronic pain can readily cope with. But over time, I've learned that medication is one tool, and I've always said that there shouldn't be a one-size-fits-all approach. A lot of GPs, a lot of pain specialists, a lot of clinics, they may use a one-size-fits-all, but you need to look at everything, which is bio, psycho, social. That's the big buzzword at the moment. But to explain further, that just means I need in my toolbox to have medication, meditation, mindfulness, communication with my significant others. I also write to get my point across and my feelings out there. Pacing is the most important one. I used to do 3 or 4 things a day and be active 12 hours a day. Now I have to pace, and I'm okay for 2 to 4 hours most days of the week, and a lot of people don't realise that. So yeah, pacing, positivity, it's very important. And you're right, it's a 50-50 thing. It's the mind, it's the body, but it's very difficult. And if you had have told me 11 or 12 years ago the pain's all in my mind, I would have said, you're wrong. But that's worthy of further discussion for sure.
Those activities, when you pursue them and when you follow those rules, do you genuinely find that, say, after meditation or after a good conversation with a loved one or anything else, you have temporarily taken the pain away? You can look back on that last half an hour and say, I didn't feel anything because my mind was more focused on this or that.
Well, you mentioned an important word there just at the end, and that's focus. So when you're focused on something, the pain may recede, but I like to use the word distraction. Nothing will take the pain away to a level of 0, and it's a very common thing that doctors and the public and the media, they've all heard of the 1 to 10 pain scale. And that's something that we chronic pain patients get used to, but it varies. It's not an easy answer. And all I can say is that distraction, communication, and taking your mind off it by doing things that you enjoy, which for me is helping others. I visit nursing homes and I talk to elderly men, and that really uplifts me because these are positive people. So I hang around positive people, and that's the only way I can answer that question, really.